Very good morning, viewers. Today we have a very special guest with us, and that is my mentor and senior journalist, Shakoor Rather. So, a little bit of description about Sir, though he needs no introduction. He is the CEO of Science Matters. He's been a journalist for almost 15 years in his life, covering politics, science, health, you name it. So, recently I saw a reel that he had made about Hantavirus, explaining what exactly it is and what is it doing to people. And there was a lot of trolling that happened, and I was like, okay, Shakur sir is the last person who should be told. So I just want to understand from you, sir, like for the people who don't know about hantavirus at all, like who haven't been very active with the news, what is all of this about? Sir, I think I cannot hear you. You're muted, yes.
Yeah, sorry. So,
No
so
worries. Yes, sir.
yeah, we've seen the news that a Dutch flagged ship saw some cases of hantavirus, right? So
Yes.
what is happening is, a lot of misinformation around this is spreading online,
Mm-hmm.
wherein people are relating this vaccine to, this virus to a Pfizer vaccine, which is a COVID vaccine. So yeah,
Okay.
so basically, there's a document, that references to a document in the Pfizer had, issued when the vaccine was launched, which
Mm-hmm.
says, of adverse events of special interest. But that doesn't mean the vaccine causes hantavirus, because the Pfizer vaccine didn't have any live or or weakened virus, right? It was an mRNA vaccine. So and then there's a disclaimer also on the same document which says that that this is simply a list of medical events experienced by a person during the study period, when the clinical trial was
Mm-hmm.
happening. But this has been, kind of lot of other things have been added to it. Some people have also put a reference of Simpsons episode and kind of made
Yes.
several videos on it, that how COVID vaccine, mRNA vaccine, Pfizer vaccine is causing hantavirus. But hantavirus, it's nothing to do with this vaccine. In fact, it's a
Mhm.
viral disease, which is spread through rodents and
Hmm.
close contact. In fact, the infection is very rare.
Hmm.
Uh, Even the cases that we have seen, through South Africa, the South Africa which evacuated two people, so they
Hmm.
saw that they had the Indies variant of this, which only causes actually human to human transmission.
Okay.
Uh, but yeah, when we put this story out on Science Matters, so I saw more than 50 comments there, till yesterday,
Uh-huh.
which were basically, it could be anything, anti-vaxxers, anything. We know that, misinformation,
Yeah.
people who spread misinformation, they go into overdrive when there's something
Yes.
like,
Yes. Yes.
especially we've seen in the past as well, especially with the vaccines and climate change, there's a
Yes.
lot of misinformation and disinformation
Mm-hmm.
that you see on across social media, and there are even
Hmm.
websites dedicated to
Hmm.
this kind of misinformation, which basically publish anything but science, and
Yeah.
they will quote out of context, like this document was quoted totally out of context. And there are
Hmm.
multiple fact checks that have happened on this, including by the Reuters, which
Hmm.
debunked this claim that hantavirus has anything to do with the Pfizer vaccine.
COVID vaccine. Yeah. Yeah. I mean, sir, the COVID happened because of bats, and hantavirus, I think, happens because of mice. So, I mean,
Rodent.
could you just go back a bit into the origins that how this happened? Why is it a threat to people like you and me? And what are the symptoms?
So, this is a disease that spreads in the wild among the
Hmm.
rodents itself, but it is very rare to see that this spreading to humans. But in this case, the strain that has infected the people on the ship that is
Hmm.
in question here happens to
Hmm.
be the Andes virus, which is basically variant, which is the one which causes human to human, infection. But it
Hmm.
happens in a closed setting. You have to have a prolonged touch with the person infected for
Hmm.
this kind of a virus to spread.
Hmm.
Till now, it's very contained. We haven't seen any. We've seen people from Indian origin, have shown symptoms, but in India, we don't see any cases of hantavirus till now. And
Hmm.
the expert that I have also spoken to, they said that it's a completely different disease compared to COVID-19, which
Hmm.
was SARS viruses are more virulent, but
Yes.
hantavirus has more death prevalence between 30 to 40%, which was not the case with COVID.
Hmm.
We had a lower
Hmm.
around 8 or less prevalence. But yeah, it is a deadly disease. It is a deadly virus, but very rarely spreads between uh, you know people to people. The symptoms could be anywhere between it has like mucus, breathing problems. Basically, what happens during pneumonia. It has pneumonia like symptoms as well,
Okay.
which was the case with
Pneumonia is fatal. I mean, my own grandfather had unhealed pneumonia because of which it got into bronchitis and then, it caused his death. So,
right.
I want to understand what are the ways that a person can contract hantavirus? Is it through in-person contact? Like in COVID, we had air-to-air transmission. But is hantavirus like spread through touch or sexual contact? Like what kind of a contact should be avoided in order to safeguard oneself from hantavirus?
See, till now, the WHO recommendation is that it happens when you are in very close contact with the rodents,
Hmm.
or you
Hmm.
touch their saliva or aerosols, or you spend a lot of time in a room where these infected rodents have been.
Okay.
Yeah, so
Yeah.
currently, where air-to-air transmission has not been documented, but you
Hmm.
never know, that might happen. There are some reports I was seeing this morning that, has hantavirus become air-to-air transmission disease as well. So we need to wait and watch. The WHO is monitoring this disease. Uh, Hopefully, this should not be a start of another pandemic. We all can hope, but you never know with diseases, with viruses, with the climate change. With the way the a lot of this their habitat shifts have taken place,
Hmm.
temperature fluctuations are happening, right? All these play a role, in the virulence of a disease, right? So we
Absolutely, sir. But I mean, I was listening to the Prime Minister, and I know you like to steer clear from politics, but he's warned people of, of course, there's the whole Forex angle to it, there's the whole Iran war angle to it. But do you think that the warning of work from homes and to brace for impact like in a COVID like situation has to do with intel to the Indian government that they're slowly hinting to the people without being too explicit that you have to prepare for an outbreak?
I think these are two unrelated events.
Mm-hmm.
That has more to do with the geopolitics and the way forex reserves and all are concerned. This has
Mm-hmm.
nothing to do with that. Yeah. Otherwise, people would have been explicitly, they would have given recommendations on what people should do about it. The
Yeah.
health regulatory agencies would have gone into overdrive. They would have started taking, because after COVID-19, nobody wants to take anything for a chance, right? So
Yes.
I think, yeah, I mean, these are two totally unrelated events, but I mean, you never know. You can never rule out anything, right? Both the things can
Sure.
happen at the same time. So yeah.
I mean, news has gone crazy. It's on steroids right now, like with Trump in China. And I was reading, it was so interesting that Marco Rubio's name spelling had to be changed in order to let him in. But that's a very different event. Coming back to the science of hantavirus, what do you think should be done to prevent oneself from, contracting it? Like, what are the cleanliness measures we can adopt in our own homes? Because even though we live in urban areas like, Delhi NCR, or probably if viewers are watching from a Kolkata, Bangalore, Chennai, whatever regions, tier 2 cities, tier 3 cities, we've got mice infestation in India, in houses, in colonies, in all of these places. We've got
True.
baggy storerooms with a lot of, rodents around. So, I mean, what is the kind of things that we can do in order to, prevent ourselves from contracting this virus?
Yeah, first of all, we have to be, careful of the fact that there is no outbreak yet. Nobody, no health regulatory organization has said that something like this is there in India till now,
Hmm.
right?
Hmm.
But yeah, at a personal level, I think like you said, we have a lot of density,
Yeah.
population density, and then we see people live in areas where there is rat manifestation, right?
Yes. Yes.
You could end up in a place where a lot of rats, infected rats, could be there, right? So
Hmm.
the ideal thing would be to avoid dingy, rodent infested areas, and also staying inside such rooms for longer times. Especially people who work in delivery, food delivery, and all.
Yes.
You go to these stores and all, right? So all the storages have to be careful. They should ensure that there are no mice infested storages, right? Otherwise, it could reach through home delivery and Blinkit and others. It could reach anywhere, right?
When
If
you
there,
talk about Blinkit and Zepto, sir, there was this whole debate about a finger found in an ice cream, if you remember. So, I mean, dark stores have their own dark realities, if I must say. Like, there was this whole movement by Raghav Chadda also to, increase the time and everything. But talking about hantavirus specifically, do you think that the FSSAI or other government bodies should be taking like more cognizant checkups the way they do a surprise checkup, and it becomes news every kind of 2 months? Like, should it be like every 15 days, every fortnight? Do you, as a science advocate, and as somebody, as a thought leader in this space, would you recommend something like that to the government?
See, actually, that is something for the experts to decide because they are there. They know the drill, right? What should be the
Hmm.
duration and how should it be fortnightly? Should it be daily kind of monitoring? I think the crux of the matter is that the monitoring should be there, and
Hmm.
there should be accountability on that. It should be
Hmm.
very transparent, right? If
Hmm.
SSI is doing their due
Hmm.
bit, they should be transparent around it because we have seen a lot of times we've seen adulteration. We've also there are a lot of reels also. I don't know if they are correct or not,
Hmm.
by a lot of influencers who have pointed out that these stores, the Blinkit stores or Zepto stores or whatever you call them, they do have manifestation of rats.
Hmm.
So and they do spray these uh, anti-rodent chemicals and all everywhere.
Hmm.
So that needs to be monitored, I think.
Hmm.
This because that is where the infection could come from, right? A- and
Hmm.
and also it could also come through travel and all. So there should be screening and monitoring, and which I'm sure the health authorities, they know what to do in a situation like this because we've gone through COVID now. There are no, we've learned our lessons, right?
Yes.
How diseases, especially the virus related diseases, can spread. How
Hmm.
zoonosis happens, like in the case of COVID, right? How this that disease jumped uh, from an animal. It's still debated whether it was a rodent or
Yeah,
a
it was created, or it was, yeah.
bat
Yeah.
or whatever animal it was. So those lessons, we now is the time to implement
Hmm.
the learnings from those lessons, right? So that anything,
Absolutely.
if that, but having said that, there's nothing to worry about till now.
Hmm.
We don't know
Hmm.
about the future. There isn't an outbreak. I think whatever news is coming out or whatever experts are saying, that this disease is contained uh, till the ship and the passengers who were there.
So
Yeah.
I consider you as an expert in this field because 13 years is not a less time. But do we have a vaccine? Do we have an antidote for this virus yet?
There were research teams which were working on a hantavirus vaccine. That is what the
Hmm.
reports say. But Some reports say due to the lack of funds, that hantavirus vaccine trial didn't go through. But yeah, currently I don't think there are any. I mean, I may be wrong,
I
but
don't understand this whole money narrative. I mean, we've got money for war, we've got money for guns, we've got money for every trash in the universe, but we don't have money for science. So, I mean, as the CEO of Science Matters, as somebody
so
who's seen
that is
this
a
field evolve, what would you say to everybody who's listening to you, right from citizens to the government?
So that is the case with even a lot of diseases which are already causing a lot of deaths and
Yeah.
infection. For example, dengue, for that
Hmm.
matter. Right? We don't have a very potent vaccine against dengue. There were a
Absolutely.
few vaccines that were launched, but they don't work against all the variants of the dengue virus,
Yeah.
right? Even the therapeutics are there, but it's a largely a disease which is managed, right?
Yes.
I mean, someone who reported and researched on dengue across South Asia. I mean, I was shocked to find that there were no effective vaccines against the disease, and every year we have so many cases against it, right? That is why
Absolutely.
some people. That is why it comes under the coming to your question. It comes under the definition of a neglected disease. Uh,
Yes.
so there are diseases and there are priorities. There are also commercials involved, right? After all,
Yes.
these companies, be it Pfizer or other companies, they are all profit-making companies, right? They will also kind of put in money where they think they will benefit from, right? So there are a lot of then there are regulatory issues also. But in case of diseases like, yeah, lesser known diseases, people don't take them seriously unless it becomes big, like COVID. And we saw during COVID, we saw vaccines were created during a record time, right?
Record fastness, absolutely.
Never.
Like there was this run for being the first. So Russia, and then India, and then the US, and they even China. They came up with the vaccines. So, and the whole world was vaccinated. 3 shots people took on average, and of course the anti-vaxxer debate is there. But not going deep into it, I just want to understand from you before I let you go. Uh, what are the things that we can do to not actually be impacted, like our immunity, how can we strengthen it in order to not just prevent from a hantavirus or a dengue situation, but because virals also mutate very fast and bacterial infections also mutate very fast. So if I have to ask you 5 things that you do in order to keep yourself healthy and happy, what are they?
First of all, nothing can protect you from a virus. If it is the nature of a virus, the virulence depends on that, right? But yeah, even if you are infected, some people fare better, right?
Yes.
Because of a lot of good habits that they have. So if you have better immunity, you can fight a virus better, right? If you are taking care of yourself, you're sleeping well, you're exercising, your physical activity is good, you're eating right, right? You don't have a lot of stress levels, you're mentally also healthy. I think all these
Hmm.
things, they go a long way, in deciding how you cope with any kind of infection, be it viral or bacterial, right? That is there.
Yes.
But the biggest pandemic here is of the misinformation. That is where it
Hmm.
started, because that is what this reel was all about. If you see, when this reel went viral, then we've never seen on Science Matters page, we've never seen so many comments. And,
So
yeah,
congratulations on that. I mean, congratulations on the fame. Because
yeah,
as we say, no publicity is bad publicity.
but in a bad way, right? These you see, how these misinformation factories go into overdrive when they see
Yeah.
someone kind of fact checking, or someone is putting the right information, the
Hmm.
scientific information out there. So that
Hmm.
is what we need to be more aware about. We see,
Mm-hmm.
we started Science Matters because of what I was seeing, such misinformation spread by not only these trolls, but by
Hmm.
even influencers, knowingly, unknowingly. They quote a
See,
random
about
study.
influencers, sir, if I can keep my 2 pence here, I mean, nobody really questions how they source their information. They don't even
Exactly.
cite the reports. Like you and I have worked at the same news agency. and we knew our
Exactly.
sources were sacrosanct. I mean, if a sentence does not end with said this, said by this report, we our copy was trashed brutally. I mean, it could have been the
Exactly.
best story in the world, but we've got
They
to
will
quote.
they will randomly say a study says this. Which study? When was that study published? Was it a
Exactly.
correlation? Was it a causation? Was it a correlation? Those things are not taken into consideration because they don't have the training to report on such issues. They are very sensitive
Absolutely.
issues. And science doesn't happen like overnight. Like if a study
Yeah.
comes today, I cannot just report on it based on just this study. I have to also take into consideration the context, the previous
Yes.
research, what has happened over the years. A lot of people
Hmm.
ask, what is the science. One day they say that alcohol is good, the second day
Yeah.
they say alcohol is bad, but you have to be consistent. You have to see what the science says over the
It's
years.
relatable, of course. I mean, alcohol, I mean, wine levels and certain alcohol levels can be good for sleep. But are they good for your heart? That's debatable. Are they good for pregnancy? That's debatable. So, I mean, the whole overdrive of influencers telling ki ubtan se gore ho jaoge, I mean, that has really taken a different turn altogether. I mean, you cannot advise on medicine. And even Priyanka Chopra and another South actress, I think, had told about how she took ginger and it cured her. But ginger can be allergic to so many people. I mean, I can see a reel and put besan on my face, but what if I have sensitive skin? So, I mean, the whole notion of having a doctor, a licensed professional, that is so not, taken into consideration. People are asking AI about, their symptoms. So,
Don't
what
get
do you
me
have to say
started
about
on
that?
AI. Is also, causing a lot of misinformation. We've seen
Yes.
with Dr. Trehan and all, how
Mm-hmm.
his videos went to deep fakes went viral, during
Yes.
COVID. And
Yes.
many other doctors across the world, their famous doctors, their videos
Mm.
were shared, deep fakes were shared on
Yes.
on social media, where they were peddling supplements, talking about different diseases in different contexts, right? So that's why I said, misinformation is something we need to watch out for more than the symptoms
Absolutely.
and other things.
Absolutely.
Right now, misinformation is the biggest disease and biggest pandemic. So
Hmm.
that's where we need to be careful about. And AI is there to make things worse in the
Well,
in the. We live in a
absolutely.
post-truth world, and that is why we need spaces like we created like Science Matters, which can give you factual
Sir, I think
news.
I've lost you.
Can you hear me?
I lost you. Your audio is not there.
Can you still hear me or not?
Mm, no. That's fine, sir. I think I got all my answers, and so did the viewers. Thank you so much for sparing the time to be with us, and I hope to see you more often about more science topics. And someday, can you talk about geopolitics and politics? I would love that day because you've covered it. So it's not that you don't know about this beat; it's just that it doesn't interest you anymore to discuss. But thank you so much once again, and viewers, keep watching the NEAP and also watch Science Matters for everything that is related to health and new research.
Thank you.